Okay, awesome. Well, thanks so much everybody for joining. I know several of you have submitted letters of interest and others have not. That was an optional letter of intent, but today's office hour is really focused on, is this advancing? Providing information around the round 2 GEAR, or Geriatric Emergency Care Applied Research Network 2.0, Advancing Dementia Care, request for proposals. So this is really meant to be more of an open engagement of, come to us with questions. Hopefully you've started to go through the instructions for this funding opportunity, and you might come to it being like, well, what do you mean by this? This is that opportunity. We're going to walk through those instructions with you today, and sort of expectations and an understanding of the instructions. Before we begin, maybe we'll just do a quick round of introductions. I think that might be a good way to start. I'm going to go ahead and lead off. I'm Eula Wong. I am an emergency physician based at Yale. I'm a health services researcher focused on geriatric emergency care and MPI GEAR 2.0. Pass the baton to Manish.
Yeah, so welcome. I'm Manish. I'm based at University of Wisconsin. Similarly, I'm a geriatric emergency medicine researcher focused increasingly on dementia, and one of the 2 MPIs for this.
Great.
Chris.
I'm Chris Carpenter. I'm at Washington University in St. Louis, part of the GEAR COI team, and researcher in dementia guideline development and implementation science. Scott?
Good morning. I'm Scott Dresden. I am at Northwestern University in Chicago. I am the lead for the research core for GEAR 2.0, and pleasure to be here.
Great, and we're very fortunate. We're all at different locations, and at each of our locations, we're fortunate to have project managers that help us move forward with this work. So I'm going to have each of us call out our project managers. Anna?
Hi, like Eula said, I am her project manager here at Yale for GEAR 2.0 and also work with her on the data core.
And
Hi, I'm Ange. I work with Dr. Shaw here over at UW-Madison, and I'm the project manager for our side of things here. Jessica?
Hi, Jessica Leggett. I work with Dr. Carpenter at WashU. Zach?
Hi, I'm Zach, and I work with Scott, Dr. Dresden at Northwestern.
And I'm going to just call out the participants based on the order that you appeared, or at least I think the order that you appeared. So Justine?
Hey, I'm Justine Seidenfeld. I'm a emergency medicine physician at the Durham VA. Currently, I recently completed the National Clinician Scholars Program at Duke and the Durham VA.
Welcome. I'm not sure, was it Alyssa that came on next? Or Melissa? Oh, we'll go with Melissa. Melissa, your camera's on, so.
Okay. Hi, my name is Melissa Harry. I'm a research scientist with the Essentia Institute of Rural Health. I am one of the researchers that helps our Level 1 Trauma Center maintain its Level 1 trauma status. And as part of that, we do research with our emergency department. So, and we did have a research area or a research idea in this area that we would like to learn a little bit more about. So,
excellent. Welcome. Alyssa Cooney?
Hi, I'm Alyssa Cooney. I'm a geriatrician from UT Health Science Center, San Antonio. We're looking to start more involvement with geriatrics in the ED at our institution and focusing on dementia. So I'm here to learn more.
Excellent. Well, welcome. We're delighted to have the 3 of you. And as Angela brought up earlier, we are recording this because there were others that were also interested that maybe could not attend, and this will be posted publicly. So just want to forewarn you, any questions you ask, our policy has been very much to try to be very transparent and very open and share information with everybody. So just know that. So welcome and thanks for joining. So I'm going to go off and just go ahead and start the discussion. This is what we hope to just cover briefly, but really, we can pause for any questions, and then we're gonna have lots of time for questions afterwards. This doesn't have to take the full hour. We'll go over background, some key highlights about this round 2 funding opportunity to make sure that you're aware of. Talk specifically about the support that you'll receive if selected, in addition to funding. So some of the supports that the gear, you're like, wow, why is this such a large gear core with like, all these individuals, the resources and things that we provide with there. Again, really draw your attention back to the website, and I'm going to encourage you to continuously check the website because it is being updated with information and things. And the fact that we're actually going to have a second office hour in December, really more of an opportunity with discussion about your proposal approaches. So those are some of the things that we're going to cover in today's meeting. So background, this is a lot of the information you can find on the website, but just broadly an overview. Gear 2.0 is really, it's funded by the NIA to build an infrastructure and advance the science to support emergency medical care for persons or people living with cognitive impairment or dementia, and engage in a wide variety of stakeholders with an emphasis on people living with dementia and their care partners. As you can see on the right-hand side of the screen, we have a lot of partnerships with a lot of not just research organizations, but foundations and organizations that support, community organizations that really focus on healthy aging, dementia, emergency care, geriatrics, care partnerships, and with caregivers. It is a phased award. So the first 2 years of our project was the R61 phase, and this is where we really move forward with identifying research priorities and gaps in 4 key areas. Any of your pilot proposals or any of the pilot proposals that we have really need to target and focus on at least one of these priority areas of care transitions, communication and shared decision-making, detection, and ED practices. So what actually happens with the ED care that these individuals receive while they're in the emergency department. The R33 phase, which is what you're experiencing, is then to put out funding opportunities to support and grow researchers that really can help generate the evidence around improving emergency care for these individuals. And over 3 years, so we're in round 2 right now, we're going to be putting out over $1 million worth of funding, with partnered funding. Again, the goals are to put out research grants, really move and focus on this transdisciplinary interorganizational growth. So really, you'll hear throughout today's presentation, like, and hopefully you see in the RFP, the importance of partnerships with, it's not just sitting on like emergency physicians or sitting on geriatricians or dementia experts, but like the partnership and working together in the proposal. And then moving forward to publications, and then, some pilot studies that will allow you to then move forward with larger scale projects. Again, the R61 phase, what we did was we had a stakeholder consensus conference, completed scoping reviews around those 4 key areas, and we have manuscripts that were published back in August that really highlight what the key research questions are in these 4 areas. These research questions were generated not just by clinicians and researchers, but also many individuals who are persons living with dementia, and also their care partners. So really the importance of really bringing voice and priorities to what they think are important that we study in the research. And so I encourage you all to be sure to check out those papers. They really give the framework of what your proposals should focus and study. So during the R33 phase, as mentioned before, these particular RFPs that you're studying right now, your proposals that you're preparing for, they're for 1-year pilots, so 1 year in duration. The funding is $120,000 over the year, of which $30,000 is sort of required institutional support. And if you have questions about what that means, this is the time to ask. Again, the goal is whatever you're proposing to really promote and really try to pull together a transdisciplinary research team that really focuses on the research, answering the research questions and the research gaps that would allow us to advance the medical care for persons living with dementia and their care partners. I think, Manish, do I hand this part off to you now?
It's not a day if I don't forget to unmute myself. I can do this. Yeah, that's fine. Next slide. So there's a few key parts to these grants that we just want to highlight. All this stuff is written on the website, it's part of the RFA, but we want to make sure that it's kind of front and center for all of you. So one thing is that either the PI or the co-PI must be have an appointment in emergency medicine. We have had primary PIs be geriatricians, dementia experts, neurologists, neuropsychologists, whatever the case might be, but also to have then a co-PI who is an emergency medicine faculty type appointment. The proposal has to be transdisciplinary. This is a really important component to quite honestly do research with people living with dementia, but at least two specialties, disciplines, stakeholder groups. We're going to be looking for that to be responsive. And then finally, and this is really this is an NIH rule, your institution needs to be organized for humanitarian purposes and established as a nonprofit organization. So I don't think it's an issue with any of you, but you can't be coming in as a private for-profit company or something like that. I saw a question that was popped up whether a trauma surgeon would qualify as emergency medicine, and the answer would really be no. I would encourage them to have them on it and be involved, especially if you're doing something trauma related. But I would have somebody from emergency medicine as well involved, because for obvious reasons, for it to function in a space, in a clinical space or a acute care space, having someone with expertise related to that is important as well. Good question, though. Next slide. So in terms of the priorities for this, as Eula talked about within the first phase of the grant, we had 4 areas of research that were identified by GEAR 2.0 ADC, and those will be prioritized for funding. They are quite broad priorities, and so it'll be really hard to find something or have a topic that's not covered by them, but those are the ones that you need to follow. It's also equally important to consider and address the issues of diversity, inclusion, and health equity among people living with dementia and their care partners. And so really do think through those issues as you're proposing this grant. Folks that are early stage investigators, as defined by NIH, will receive preferential consideration, and as well as collaboration across institutions is encouraged. You don't have to, however, if you do, that is encouraged. And finally, we would strongly prefer/encourage you to actually incorporate participation by people living with dementia and their care partners. That ends up being an important group, an important voice. I think all of us that are leading this can say that we've learned a lot by having them so significantly involved in every step of everything we've done around the first phase of this grant. And so we would strongly encourage you to have those folks involved. Let's go to the next slide. Any questions at this point? We can pause here just around the priorities and around the grant themselves.
And I put into the chat, I think some of you are seeing them, but links to, it sounds like you've all reviewed the instructions, but in case you haven't, the website, sorry, actually, I think it looks like I put in the registration link. So we'll put up the instructions specifically for the RFP, but then also like specifics around NIH policies. Our goal is really to target early stage investigators.
But ultimately, if you have a really good grant and you're not an early stage investigator, it's not like you're excluded. It's just one component of it. Okay, why don't we go ahead and go to the next slide. We're going to talk a little bit about the support we're going to give you if you get the grant. And I think this is an important component we want to lay out there so that all of you can know what you're getting into, so to speak. So next page or next slide. So within the organizational structure here, you just need to really look at the bottom level. We have 4 cores that we've created: a research core led by Dr. Dresden, a data informatics core led by Dr. Wang, a D&I core led by Dr. Carpenter, and then a research engagement and retention core led by Dr. Gilmore Bykowski, who's not here today. These 4 cores, if you go to the next slide. Oh, sorry, I forgot this. And here are the core members that comprise these 4 cores. And these are folks who are national experts in dementia research, in emergency care research, and in the domains we were talking about. Next page, or next slide. And so within these 4 cores, what we have done is we've created a curriculum that would span the academic year to really help with these grants. The thought behind this is sure, everyone has their expertise and their experience doing research, but whether it's because you're moving into the field of dementia, or whether it's because we can even further help the studies get better, further help the research that's being done, over the year, we're going to have seminars that cover those 4 cores. What this consists of is about 4 hours a month of total time between the seminars and discussion. And already in doing it with the current group, we've significantly improved their studies and helped them troubleshoot a number of issues they've run into. And then as well, there'll be 3 times a year where you would, if you get the grant, would present your research and progress to people from the cores to get feedback in terms of what you can do to make it better, what you can do to tweak it, and how we can help you address challenges you've run into. This is a model that's used frequently within individual institutions, within the CTSA system, within a lot of other groups. And we're doing this virtually for the broader grantees so that they can be better positioned in the future to turn this into a next level grant. The expectation is that you do attend these, because it doesn't really help if you're not there, obviously. Next slide. Oh, sorry. Okay, so we'll pause here. Questions about the year, so to speak, and what the resources are for you. Okay. Ange, I think you're gonna take people through the website. Was that correct?
Yes, yes, that is. And so, I'm gonna just share my screen. Come on, screen. Okay. Does everyone see a home page for the Gear website?
Yeah.
Yes, beautiful. Okay. So I'm going to go over this very briefly because I am sure some of you grantees here have interacted heavily, at least with the funding opportunities page on the website. Really what I want to highlight is that this website has been built as a resource to make your guys' lives easier. That way you're not searching the internet for our manuscripts, our priorities. It's all been compiled here for you very lovingly. So first off, Gear 2.0, if you're looking for any information about the research priorities, what exactly we are, who our partners are, you can go right under our Gear 2.0 tab. Right here, you see we have our different work group topics, kind of why we chose to focus on dementia itself. As well, the thing I'd like to point out is our consensus summary. So if you want to get into the details as to really how that meeting process took place over those 2 days, how we arrived at the priorities we did, that information is available to you there. Manuscripts and publications have also been compiled for you here on the website. We have the editorial. We also have links to all of the scoping reviews, so you can dig into those in your free time, and as well some of the other publications related to Gear 2.0 work, such as our methods and Gear 1.0 activities. Now, as well, to give you a better sense of what some of the core activities may look like, you are welcome to go under the Gear 2.0 Resources tab. Now, not all of the materials are available to you because some of it is restricted to the Pilot 1 grantees or is specific to those current projects we have going. But there is a lot available that I think at the very least can give you a sense of what you should be expecting if you were to be a grantee with us next year. So some of those things are the seminar calendar.
Oh,
Oh, wait, what is this?
so if you
Sorry,
just click resources, yeah,
Oh,
that'll be
oopsie.
the public.
All right, there we go. Yeah. A little too click happy. Come on. No, I already did it. I already did it. Okay, there we go. So under here, we have tabs to the videos and webinars. This will give you a sense of the types of trainings the cores do. And we have the research core training, data core, dissemination, implementation, as well as meeting PowerPoints and notes. So if you don't like visuals, if you're much more of a text person, you have those available to you here as well. We have our charters. So if you want just a general summary, you can go under here to look at each group, what we are aiming to do, what we plan to do over an academic year. We have some supplemental materials and partner resources, and hopefully here in the coming future, we'll have some podcasts available to you. So our hope is that at least that'll give you a sense of the type of activities that'll be going on in the future here with us, and hopefully be enticing as well, because it's a lot of really fascinating resources and a lot of really good, rich resources that we think will really prepare you guys for those larger NIH projects in the future. Yeah, anything else that you guys like me to hit, Manish or Eula? Otherwise, I'm gonna just stop sharing.
No, thank you for that overview of the website. Again, if you haven't had a chance to check out the website and click around, I did post in there the link to get to just this proposal instructions. But as Angela just demonstrated to you, there's material that's being put out there. It's the website is continuously being updated a lot because we're generating information, so where she just showed you the videos, those are all videos that the current round 1 pilot awardees, like they're going through sessions about what does it mean to recruit and work with persons with dementia. If you're used to administering surveys, right? Is it the same when you administer to someone in the ED that may have cognitive impairment? Some things that maybe we're not as experienced with, and considerations, things about how are you going to target and identify these patients. Those are what some of those webinars are targeted and focused on. And those are the things that if you are a round 2 awardee, the kind of supports that you would receive. So I think maybe before we dive into questions, I'm going to just screen share again one more time because we'll have a QRX code. As mentioned before, you can save the date now, but do you guys see my screen? Does it have a QRX code on it? Great, I see heads nodding. Okay, so today's, our hope and focus is really on any questions you might have specifically about the instructions for the grant, like you might have questions about the budget section. It's kind of complex, and we really try to walk you through, like when we say there's X amount of funding, that's total costs. So you have to then work backwards and think about your own institution's indirect costs and how to account for that in the budget. It's all in a template. Today's webinar is to answer those questions. The one on the 15th is going to be about approaches. So really, the approach section of your proposal and considerations of well, if I'm going to be trying to work with persons living with dementia who have trauma, what does that mean? How do I think about identifying those individuals and recruiting them? We're not going to be reviewing or going over we'll not be able to, tell you what to do in your proposal, but we can try to help you think through some of the approaches and some considerations. And so that's what this webinar is going to be. It's on December 15th at 4 p.m. Eastern Standard Time. Just like with this one, we do request you register because we don't want to put an open link to a Zoom meeting out in the public and then have bots join. If you just put your phone up to that QRX code right now, it should take you to that link. Or I will post in the email right now that link. Or let's see, I think I had it saved up. Here we go. Here's the registration link. Is that the registration link? Maybe not. I believe that's the registration link. Oh, sorry, there's the registration link. So Anna put up the registration link. Okay. So the last email that Anna put up, that's the registration link for the session on the 15th, if you're available to join. If not, as mentioned again before, it will be recorded. And we encourage you to listen to the recording if you're not able to make it. Okay, so I think we're going to now open up for questions. Any questions you have?
I was wondering if you could briefly tell us about the projects being done by the current grantees, maybe just to kind of scope and make much overlap.
Yeah, I'm happy to sort of briefly give the titles and descriptions. Actually, I think we're actually working on trying to put on the website the 3 awardees, at least, you know, who they are and the titles of their proposals. That's going to be going up soon. But our 3 awardees, I'm going to do this off the top of my head. I don't remember their titles of their proposal. If someone else has that, please correct me. But we have 3 awardees. They are Alex Lowe at Northwestern, Cameron Gettle at Yale, and Brock Daniels at Cornell. Cameron's project is really focused on a post-transitions sort of telehealth using like mobile devices to sort of facilitate care transitions, and he's working with an AI company. Again, he's not a profit company, but he's working with another company where they're trying to do some pilot and feasibility evaluation from the perspectives of care partners and the patients themselves, about, you know, what they would like to see with this, and so that's a pilot. Brock Daniels' project is focused on paramedicine sort of telehealth follow-up program with patients after their discharge from the ED. And Alex Lowe I would describe it as more, I think he described it yesterday as more of a qualitative evaluation, trying to survey persons living with dementia, and if they have care partners, it's a targeted group of patients that they're trying to do a sample of about 30 or so in their ED about what matters to them and what they would like to see in terms of ED care. I'm going to turn to the rest of the group if I've sort of misdescribed those pilots, because again, I was just doing it off the top of my head.
I think the bigger thing is, unless you're like doing exactly the same work as somebody else, which is incredibly unlikely, your application is going to be considered in isolation in terms of the quality of your application and what's the significance, what's the innovation, what's the approach. And so it's good to know that, but just because, you know, someone's done project A does not mean that there's no room for similar projects.
Alyssa has a great question, and Chris, Alyssa, I'm going to read out Alyssa's question, and Chris, if you want to read out what you had stated. So Alyssa had the question, if there are co-PIs, do both need to be early career? Chris, do you want to?
Yeah, I just cut and pasted the eligibility from our RFA, and it says the PI or co-PI must have primary faculty appointment in emergency medicine. Like Manish had said earlier, the PI assumes responsibility for all grant activities, and the proposal must include transdisciplinary collaboration with at least 2 specialties, disciplines, or stakeholder groups. There's nothing in there about early career.
Yeah. It's sort of a priority for us, like if you have early career, you know, so I guess the way to think about it is this. If this is a person who has a center grant and they've had multiple R01s, like, do they really need this pilot funding, right? It's this, we're really trying to bring more support to those people who are really just diving into this. So it's not that you have to be this, but our priority is really to bring support to early career investigators, but it's not a requirement. Manish, do you want to expand on that?
No, I think you said it really well. It's a priority, but it does not disqualify you.
And I think that the content in the seminars and everything, though, might be, you know, a little bit more geared towards early career investigators, will certainly be helpful for people kind of throughout their scope of career. You know, we had an associate professor on yesterday who's a co-I, you know, who got good feedback has done a lot of qualitative studies, but not with persons living with dementia. So got good feedback from kind of the whole group about how to incorporate what she's done previously with this particular population.
Yeah, I think Scott, that's really a nice example. We've worked really hard to assemble these core members. So these are all individuals that are part of like one of the cores that, Scott, Chris, I, sort of lead, and we've worked really hard to bring. These are some of the national experts, so you've got individuals in here like Andrea Gilmore-Bykowski, like she leads the recruitment, engagement and retention core. She's got national expertise in really ensuring how to work with these individuals, bring them from the community and keep them in a study. This is not an easy group to keep, enrolled in a study. Heather Allure, world nationally renowned for her methods and her approaches, especially when it comes to dementia studies, right? So she, when you have any time with her, any of the individuals on here, lots of expertise. Heidi Gill, she's from a community program called Live Well, where they have a lot of engagement and bringing in persons living with dementia. Not only are they a facility, but they also really empower persons who live with dementia in terms of how they can help research studies. So not just be a participant in a research study, but help think about and design a research study. And so, engaging with her early on, we're trying to think of ways to, have her team bring supports to the, your study proposals early on, rather than like after your study's done. So. Hi, Sangil. I see you've joined. I wanted to just reassure you, we're at the question part of today's session, but we have recorded it. And so if you feel like you've missed a lot of the stuff, don't worry, this will be posted. And so you'll be able to also hear this.
I got my computer kicked me off for a couple of minutes, so I might have missed it, but did you talk about the institutional support component in a little more detail?
I can jump in there. We didn't go into the detail on that, but basically what we want to see is some level of institutional support to do your project. And that support can range from time for you so that you don't have salary effort on the grant. It could include research staff. It could include an enroller program that you tap into. It could include staff people within the department. It's fairly flexible. It just needs to be, we want to see some level of institutional commitment as part of this grant for the applicants.
Just to give a couple of examples, it could be that, they're going to commit to, covering some of your time, or some of the other, co-investigators to say like, we'll contribute, say you have a project manager, like the department will demonstrate the support with, some support with a percent effort of a project manager or a percent effort covered by you. It's again, as Manish said, you can be creative here, but again, it's really so that you as a pilot awardee are not sort of covering all this on your own, and really that that your institution or your department is vested in your success.
It's like you're at the VA. I don't know if you've been given any aids just as a startup to do research and get established. That could be your institutional support. Other questions, areas of confusion?
This is Melissa. I have one question. When we were on this part of the slides previously, it was mentioned that we would receive potentially, not we, the awardees would receive 90,000 in awards, and then with 30,000 institutional. So that would make the total amount 120,000. I just wanted to make sure that I heard that correctly, and it's not additive. So it would be 150,000 available for the study.
Did I misstate that? I might have misstated that.
I think that's what it used to be. We increased the
It's-
awards this year because
Okay,
we were able to increase the awards. Let's just leave it at that. And so it's 120 plus 30 now.
Yeah,
Okay,
I'm
great.
sorry. That was, Melissa, thank you for asking that question. I might have misstated that. And so the key thing is going to be going onto the website and filling out that there's an Excel spreadsheet. And if you follow that Excel spreadsheet, you will ensure that you have the right amount of money that the actual dollars you'll receive, and then the percentage. There's a separate column for, demonstrating that institutional support. So I apologize if I misstated the amounts.
There's also on the website a presentation regarding the budget that kind of breaks down more specifically like where the 120 comes from and the 30. So yeah, it is 150 total, the 120 plus the 30. But that presentation will also kind of go through that as well if you want more details.
Thanks, Anna. Definitely check out the website, check back, continue just to check back. It's still November. I know it feels like it's early, but January will come up on us really soon. But continue to check back on the website because there are, as Anna mentioned, there are videos that show you how to do this budget spreadsheet. There's an FAQ sheet. We have commonly asked questions, and I will also let you know if you have new questions that come up for you as you're doing this proposal and you're like, gosh, what am I supposed to do? You just write to the gear at gearnetwork.org. It ends up going to Anna, right? And then Anna will field it to Angela or Manish or myself or whomever. And then we're going to post your question on that FAQ sheet, the frequently asked questions, with our response, so that we'll send you an email back, but we're also going to post it because your question is often a good one. And we want to be very transparent so that others also get the same information, and we're giving the same, we're being very transparent in the information that we provide to all applicants. So that FAQ sheet will get updated on occasion. Some of the questions from the FAQ sheet were from last year, but it's applicable this year. So it's just going to continue to add on or get put into there's sort of sections of that FAQ sheet, but do also check back on that.
Should we touch a little bit on the time commitment that the scholars will have to commit to if they get the funding, as far as the sessions and the webinars and the core meetings?
I think it's probably worth reinforcing. I had it on that one slide I briefly mentioned, but just want to make sure it's not a surprise to any of you that the curriculum piece that we have averages around 4 months of time. And then in addition to that, there are 3 presentations a year for feedback on your project. Bottom line, this is going to be incredibly high value for all of you. But the expectation is you attend that.
Yeah, Jessica and Manish, thanks for sort of emphasizing and highlighting that. I will say we've had 3 of the research in progress sessions so far, 1 for each of the pilot awardees, and they're going to have that opportunity 2 more times for the rest of this year. It's not meant to be work for them. It's like, here's an update here's where I am on my project. And for every research in progress session that we've had, I think they've been phenomenal, right? Because the pilot awardees get to sort of talk about questions or problems that they're having, and they're problems that we all encounter with our studies. And then they're again, you've seen who core members are. You've got now these national experts who are weighing in. Well, did you consider this? What about this? Have you thought about this? Chris chimes in with really excellent guidelines, equator guidelines or STAR guidelines, and I think everyone's just been, and then Scott's brought in some, again, just great research design expertise. You'd rather hear this type of feedback now as you're doing your pilot rather than after the fact. And then, oh gosh, I wish I had thought about that. That's why we're trying to engage and provide these supports while the projects are happening. But, again, to just go back to Jessica's point, there is going to be this expectation that, we've created all these resources for you. And so we hope that we would expect that you would engage and use them. It's not for us, you're all adults. And if you're selected to be an awardee, the more you use these resources, I think the more that you'll hopefully benefit from them.
Just one more point with the resources, like, it's not just you, right? Like the main, like the PI, like your co-PIs, your other like investigators are all also welcome to join and engage in those sessions. So it's not, just the person who hits submit.
Yeah, excellent.
I think
point,
it's
Mona.
helpful when as many from the team can attend, because there's a good dialogue that happens. It has happened in those 3 sessions when that happens.
And so not to also highlight, like, even if you're not selected, these resources are up on our website right now. We continue to post them up now. So, actually for a strong proposal, you might want to start to look at some of the things that are already available and say, gosh, those are things I didn't think of. How can I incorporate that into my proposal? Because then you're sort of getting cues of like, here's what a strong proposal or a better project could, this is the feedback that existing pilots are getting. So if you're able to weave any of that information into your own proposal now, you may be better positioned and having a stronger proposal. Well, so I'm going to just encourage folks to send questions. Maybe right now you're still so early on, you haven't walked through the details of it. But before we close, I'm just going to say, maybe I'm going to ask each of the core pilots to just say, like, if you had one word of advice, where to focus on in the instructions or anything in the proposal, like any word of advice you might have for the pilot awardees. If you want to, I'm going to have each of us say something. So. Manish, anything you want to start? You want to start off?
So I'm going to echo Robin Barr, who retired from NIA a few years ago. He used to always say, if you don't apply, you're never going to get the award. And so my comment would be, even if you're starting to feel like, oh, I don't know if I'll be able to get this, apply, at least get the feedback. You may get funded, you never know. And this is a great way. This is meant to be a starting point for future grants.
Chris or Scott, who would like to go next?
I would encourage the applicants to take a look at the consensus conference reports, those open access manuscripts, and just see the rich array of thought that went into this funding mechanism and the priorities that we set. I think it'll really stimulate some creativity from your departments. And this is a pretty unique funding opportunity. So I'd be excited about it.
I agree with both of them. I think as far as the design goes, it's a short period and it's intended to be a pilot study. And so think about feasibility aims, and really a pilot study. Of course, with looking towards a larger study in the future, I think is really kind of how a good application would go here.
Awesome. Before I close, I'm going to have project managers. This I could be opening a Pandora's box. Comments from you about, like, what does it mean to work at, be part of Gear 2.0?
I guess I'll start. I think what's important is like definitely being engaged. There are a lot of opportunities for you and to help you. And I think being engaged and being responsive. We try to be as accommodating as possible with the sessions and to like tailor them to things, that you would be interested in. But we can only do that if you're engaged and responsive. So I think that would probably be my like highlight is, there's a lot for you, but you have to be engaged to experience it.
I'm going to tack on here that part of that engagement and the communication, our group loves emails. Being a national network and having so many emails from so many different campuses, or different people from different campuses, I should say, email becomes a really good primary form of communication that gets through to everyone. So we highly encourage, if there are questions, concerns, or commentary to just channel them through email. Our doors are open always. It really means a lot to me personally to be a part of this group. I really love this type of research. It's really boots on the ground kind of work. And it's really, I just think, invigorating, you know, to see this kind of work going on in the emergency care setting and just seeing how it can improve, you know, short-term outcomes, but also long-term trajectories for a lot of these older patients.
Yeah, to add on to Anna and Ange, I think it's such a great time right now to be a part of this, because the content we're creating can really you can really communicate and engage to customize it to fit your program or your project. And that's really helpful for you to make sure your project can be successful and sustainable for the population that we're trying to reach.
Yep, and I would agree with everything else that they've already said, but I would also like to add that it's really important to utilize the resources that we make, because we work really hard, all of us, to create these resources that are honestly very, very helpful, and the people who are providing them are just some of the most impressive people I've ever worked with. Very intelligent, very helpful, and very willing to help. They really care what they do, and that's what's been really important to me.
Awesome.
I think Zach means that that they're all much better to work with than they are just working with me. So he appreciates the large national network. I think that's what he
Pandora's
meant to
box
say.
just opened.
but
That is not what I meant.
No, but I actually agree. I mean, it's been a great network to work with people around the country. You know, a good mix of different expertise that I think works really well. I absolutely agree with Zach.
Yeah, I will say, just kind of echoing what Zach said, I'm new to like emergency medicine and geriatrics. I came from neurology mostly and imaging. And so it's been fun to like see how like passionate and excited everyone in the group is about like geriatrics and emergency care. And so I think that, you know, that just kind of like carries through into everything.
Thank you. Thank you, everybody, for those comments. I think the key messages here are really, it's a double-edged sword here, right? What we're saying is like, you know, you guys aren't currently funded yet, but we're really encouraging you to apply. We're encouraging you to ask lots of questions. You know, the more you're engaged, the more you dive into this, use the resources. We've made a lot of these resources publicly available. Even if you're funded or not funded now, we're here to help. And so, you know, please check out the website. I've put back up again on the screen. Hopefully you see the QR code to register for the session on the 15th. This will be sort of a follow-up. It actually will be even more open-ended. We're not going to have specific slides, but really at that point, you'll come to this session on the 15th much stronger if you've already started to lay out your proposal and come back to think about, like, you know, the approaches and concerns and questions you might have about like the best approach. But this is where we're going to sort of walk through like the importance of your study really should target persons living with dementia. If it's like, well, we're going to just sample everybody and incidentally, we're going to collect some dementia information, that may not be as strong as a proposal that's really targeting individuals with cognitive impairment. So really thinking through how you're going to identify and target those individuals. So register, again, it will be recorded. And my final, you know, if I had a final thing to say is like, this is a network. It's a network, a partnership, you know, so your proposal, the more you really highlight and work with others, you know, you've heard the importance of really someone must have a primary appointment in emergency medicine, but some of you are not coming from emergency medicine. This is the best time to reach out and start to partner with individuals in the ED, right? We're trying to give you money so that you can work with those in emergency medicine, and for emergency medicine to work with people outside of the ED. Don't forget about the nurses, the case managers, the social workers, the community partners and programs that you could potentially partner with. We've increased the funding for those very reasons, to try to make sure that there's enough so that you can, you know, maybe think a little bit bigger in these pilots. So I think those are the main things that we want to just thank you all for coming to this session. If you have other questions, please send an email to us and we will do our best to try to address them.
Thank
Thanks,
you so
everyone.
much.
Thank you.